So obviously guys, when we're treating the knee or any form of knee pain, you've got to address it in several different ways. The prerequisite for a healthy joint is full range of motion. Hey everybody, Dr. Luke String here from Advanced Health Chiropractic down here in the South Loop in Chicago. I just want to spend a couple of seconds with you to discuss how effective and how useful we have found Revive Light and the infrared therapy. We see over 300 patient visits a week. Most of the patients that we treat are corporate athletes, so weekend warriors, sit for a living, get up, move a lot at the weekend. This creates a lot of knee pain synonymous with inflammation, be it degeneration or poor muscle imbalance. We find that the Revive Light helps clean out that inflammation, that pain, that swelling quickly and effectively. We love it. We couldn't speak highly enough of it. So obviously guys, when we're treating the knee or any form of knee pain, you've got to address it in several different ways. The prerequisite for a healthy joint is full range of motion. So we're going to do an evaluation of that range of motion. So Lewis, obviously, big guy, plays rugby, lots of CrossFit, super active. And what we can see here, when you evaluate range of motion within the knee, the heel should get to the butt, and Lewis is about 2 inches away. And then he's okay when he's coming through extension here. So obviously if he's got limited range of motion in the knee, it could be coming from a subluxation, i.e. the joint has shifted, or it could be coming from tight tissue within the quad. Knowing Lewis, it's probably a combination of the both. So how are we going to address that? Well, first and foremost, inflammation is going to create lack of range of motion, and that's obviously going to create dysfunction in the knee, pain and dysfunction. So how would we address that? We would use the Revive Light to blast out that inflammation, which is going to increase range of motion. We're also then going to address the knee. So the first thing we want to do is put some traction into the knee. So we're just going to open up the knee capsule. Essentially the knee's made up of 3 main components, or bone components, at least the femur, your thigh, your tibia, your leg, and then obviously your patella, your kneecap. And we just want to get as much motion into that knee as possible. So we do some traction here, open up that knee joint, recheck range of motion. Bruce improved, but he's still got some lack of range of motion. So we're actually going to evaluate this tibia, and what we're seeing here is he's got a shift posterior because he's not moving as well coming towards me. So we're going to address that. We're going to put some external rotation into the tibia. We're going to gently bring that knee forward. Good, and then we adjusted that knee. And we've got improved range of motion still. We would then go into some soft tissue protocols. We'd address the knee, the quads, the adductors, the IT band, possibly the hamstring with our soft tissue protocols, and do a rehab program to stabilize glutes, vastus medius, hamstrings with lots of proprioceptive work. Essentially that's how we're going to address knee pain within the clinic here. Hopefully you like the video. If you're watching on Instagram, follow back and like the page, and then obviously if it's on YouTube, subscribe, turn on notification bell, and we'll see you on the next video.